So touching on the capsule a little bit, is the capsule something you take out in with every implant? Is it what the patient wants? How do you decipher if all the capsule comes out, if it doesn't?
Right. So that is another controversial topic. So, anytime you put an implant in, because sometimes I talk to my patients who are there for their implants to be removed for lifestyle changes, or they're just tired of them, or it's ruptured, or whatever. And I start talking about their options for capsulectomy, and they're like, back up. What's a capsule? Right?
Yeah, yes.
Or the husband's like, wait, what are we talking about now?
Are we still talking about her breast?
What's a capsule? So anytime you put in a foreign body, your body will form a capsule around it. So that's like a kind of like a scar tissue. It's a foreign body reaction. So if you have a pacemaker in your chest, when they insert that pacemaker, it forms a capsule around it. When you put the implant in, it forms a capsule. In some patients, that capsule's super thin and mobile, and you don't know it's there. You know, you've seen them where it's like one cell layer. I call it moonbeams, right? Moon,
So thin.
yeah.
So thin.
So thin, it's practically non existent. In other patients, that capsule can get thicker. And then that's when it becomes a problem. We call it capsular contracture, meaning that the capsule gets thickened and hard and starts to distort the implant. It can happen for no reason, or it can happen because the implant is ruptured. And so that's inciting a little bit of irritation. It can happen just over time. Radiation, which most patients aren't having, but if you radiate that breast, you will 99% of the time get a capsular contracture. It's known to be at an increased risk with smokers, although weirdly, sometimes one side gets CapCon and the other doesn't. And then we think that there might be some things at the onset of surgery that's like a low level of biofilm that creates a CapCon later. That being said, so every implant has a capsule. I can take the implant out and leave the capsule as long as the implant's not ruptured and the capsule is nice and thin and filmy, because since it's your own tissue, your body will reabsorb that capsule over time. If the capsule is thickened, I can take some of the capsule out, the thickened part out, just so it's less burden for your body to break down because it's not doing anything. And then there's patients who feel really strongly that their symptoms are not going to get better unless you take the entire capsule out. And I tell patients, if they come to me asking for that, that's their choice. If you're going to lie awake at night wondering if you're not feeling better because you didn't choose to have your entire capsule removed, then, by all means, have it removed. The studies show overwhelmingly that it doesn't matter whether you take out all of the capsule, part of the capsule, or none of the capsule. Women who have symptoms of breast implant illness prior to having their implants removed will all feel better. But again, the groups that advocate for breast implant illness just feel like the study is discredited, even though it was a grant funded study and was really, really, really well done. So again, I know people hate when I say science,
But that's what we have to go on
I
these
mean,
days.
yeah, sometimes it's science. So the science doesn't show that the type of capsulectomy matters. You will still feel better. I mean, I always liken it to breast cancer. If you have a small breast cancer, your options are a lumpectomy, just remove that cancer and then radiate the breast, or you can do a total mastectomy, just take the whole breast off and avoid the radiation, perhaps. So, those are two completely different ways of addressing breast cancer. Again, if you're the type of person who's like, I want the whole breast removed, I do not want to deal with this, actually take the other breast while you're there and do a reconstruction, that's your choice. If you're like, I actually like my breast and I want to keep it, so you can take the cancer out and then radiate it, and I'll just go with that, also your choice. Those are both equal survival rates long term. So if you're going to lie awake at night because you just did the lumpectomy and radiation, then do the mastectomy. If you're not, then do the lumpectomy and radiation. It just depends. So this is the same thing. If you feel strongly that having your whole capsule out is going to make you feel better, then we can do that. But if you're like, I don't know what you're talking about, then I usually advocate just a partial capsulectomy.
And to touch back on the capsules just a smidge, what do you sending off the capsules, what do you do with them? Do you send them? Do you toss them? I know we send them to pathology.
Right. So if there's a history of textured implants, I like to send them to pathology to look for abnormal cells to rule out any BIA, ALCL. Again, it's low. If you have a suspicion of having that prior to having your implants out, which is a completely different subset of patients, then you need a thorough workup prior to. So if you have a fluid collection around your implant or mass or something, that's a completely different pathway. But if you have totally normal implants, they just happen to be textured and we're taking out the capsule, it's usually a good idea to send them to pathology just to look at cytology and make sure there's no abnormal cells. If you have smooth implants and we're taking out your capsule because you want to, then it's dealer's choice whether you want to have the pathologist look at that tissue or not. And some people do and some people don't. Again, are you going to be able to sleep at night if you know I took that out and I sent it to pathology or didn't send it to pathology? Obviously, I have sent it when I see something concerning or abnormal, and that's happened usually with the older ruptured implants where I'm like, this looks weird. We're sending this. If I find anything in breast surgery that looks abnormal or weird, we're going to send it to pathology and make sure.